a topical, some kind of a chlorhexidine gel or a metro gel, okay? Then steroids, topical or systemic again. Anti-ulcer drugs, which is the common ones, because when you're going to give which drug, anti-ulcer is also part of it. Any analgesic. That is, suppose anything which is going to do with any NSAIDs, then anti-ulcer drugs also becomes a part of it. Astringents also. So all this again becomes a part of your anti-ulcer component. Antifungal drugs also we do give sometimes, and as well as antiviral drugs. Because right now we are in an era, not rather year, at least a few months we have been seeing a lot of viral infections happening. Okay, so we also do give a lot of viral drugs as well. So let us basically know what are these drugs that we are coming across in the clinical practice and how do we deal about it. So we first go with the biggest group, which is the antibiotic. Okay, so which is the most preferred antibiotic as far as our oral infections? Amoxicillin, right? So why amoxicillin? Broad spectrum. Broad spectrum meaning?
Wide range of range.
Wide range, which is our oral cavity basically contains gram positive and gram negative, right? Together you have one drug which basically counteracts both. So we basically prefer amoxicillin. Okay. So now what is the dosage of amoxicillin?
10 milligram per kilogram.
10 milligram per kilogram body weight is the textbook reply what sir has told. But commonly, we just can't be calculating the body weight, right? Ideally, you are supposed to have a weighing machine in your clinic. But what is the dosage normally? 250 to 500 mg. Okay, the adult dosage is usually 500 mg. Okay, which is TDs. Thrice daily that we give. Okay, up to how much can you extend?
5 to 7.
I might be sorry. 5 to 7 days fine. Children 250 mg TDS, but this is 500 mg TDS is up to 1500 mg per day that we can give, right? Can we extend it further a little more? Because see, you might get a 60 kg body weight person, you might get a 90 kg body weight person also. So you have to titrate the dose a little bit, okay? So you can go up to up to 2 grams, okay? So you can go up to a max of 2000 milligrams per day. That is up to 2 grams you can give. Make it 4 times daily. Or make it 1000 milligrams, that is 500 mg BD, 2 tablets at a time into 2. For a patient whom you feel is little obese and 1500 dose will not be sufficient, make it a 2 gram. Up till 2 grams you can go, it is very, very safe, it is not toxic. Okay, so till that time your body has the capacity to accommodate your amoxicillin. Okay, and basically this is based on weight. We generally tell children 250 mg thrice daily, right? Nowadays, we do find children who are obese as well, okay? So the 40 kg is the easiest value for you to remember. If the child you think is more than 40, go for the adult dosage. Only less than 40 is going to be 250, okay? So above 40, just straight away go in for 500 mg per 3 days per day, 3 times per day. It is absolutely safe only for the child as well, okay? So then we have another famous drug, which is Mox Plus. You have Augmentin, you have Moxiclav, so many brand names. Okay, each rep comes with a new brand name for this. Very, very affordable, cheap drug. And do we prescribe this? Quite commonly, right? So Augmentin is common, and what is the dosage? It's 500 mg Amox plus 125 clavulanate, so it becomes 625. How many times?
2 times.
2 times? When 500 is 3 times. 625 should also be 3 times. Yeah, so it's actually 3 times daily. Yes, sir. It is actually underdose that we are advising. It's thrice daily that we need to give for. It's 620 because 500 mg is into 3. That's all. We are just combining a clavulanate because we are extending the spectrum. That's all that we do. Okay, so for that you cannot reduce the dosage of amoxicillin, which means that you are underdrugging the patient. It's not going to cause you any effect at all. So probably you might be thinking this antibiotic is not working. It's not that. You have underdosed the patient basically. So make it thrice daily, Augmentin thrice. Again for children it's going to be 375 thrice daily. Again, dose based on your body weight. Okay, because Augmentin is our bread and butter. Okay, amoxicillin is our bread and butter. So amoxicillin 40 kg a patient comes, less than 40 go for the child dosage, more than 40 straight away give you adult dosage. Okay, it's not going to harm at all. Even 45-50 you can definitely go for adult dosage. So
companies itself they recommend, they give only a 6-pack dose, if you remember. It comes in a 6-pack, 6 tablets in 1 pack. They recommend only that.
So the company recommends, but ideally, sir.
10 6
Six pack.
Augmented.
Always generally.
Augmented. See, actually, sir, ideally, it is to be given thrice daily. That's how the.
What is the maximum dose of clavulanic acid that can be applied for a day? 125 to 375 or 500 varaikkum polam? 125 milligrams.
Yeah.
What's the maximum? As amoxicillin, it is 2 grams per day. For clavulanic acid.
You can also give this as BD. That is 625 twice per day. You can go for, that is BD. That is how you go 500 mg, 2 tablets make it 1000 mg twice daily. 625 mg together they can take 2 tablets, make it twice daily.
So 500 milligrams
Same,
per day.
again 500 milligrams per day. Up to 2 grams amoxicillin you can go for. Which means 125 into 4 that you can go for your 600 mg you can go for your clavulanic. So that's the clavulanic. That's basically is the one which is prescribed. And ideally we are supposed to follow that. So yeah, so that's basically the thing. I do understand there are many people still giving only 625 twice daily only. But the ideal recommendation is 625 thrice daily actually. So then we move on to penicillin allergic patients. Okay, so majority, maybe 95% of them we usually give amoxicillin. Okay, but we do have a category of 5% who are allergic to penicillin. Okay, so when they are allergic to penicillin, which do you prefer? Yeah, given clindamycin, but what do you prefer? I am sure nobody would have prescribed clindamycin still now, right? Pandringa, sir. Pandringa.
Metro.
Clindamycin, anybody prescribe?
Go for azithromycin.
We go for azithromycin, okay. Anything else, sir? Sorry? Cefpodoxin, cephalosporin. Anything else? Okay, so azithromycin, yeah, sir. Ciprofloxacin also they give. Okay. So we start with first clindamycin. Why clindamycin has been put first is because clindamycin for extended spectrum it also has an action on the anaerobic organisms as well. So instead of combining an amox with metronidazole or giving another antibiotic with a metronidazole, just clindamycin alone will be sufficient for you because it also tackles anaerobic bacteria. So the doses are around 300 mg, 6 to 8 hours. Okay. So maximum dosage is 450 every 6 hours. So this is the maximum dosage. With routine it comes as 300 milligram tablet. Okay, and usually it is around 3 times daily that we recommend. Again, you can extend it to 4 times daily based upon the patient. Okay, so that's basically, so 6 hours or 8 hours probably you can keep it as the normal regimen and extend it to one more time that you can give. One major side effect that they tell us something related to the Clostridium difficile infection, which is related to the gut basically. That's the only major contraindication of clindamycin. Otherwise, clindamycin is even preferred for antibiotic prophylaxis also. So 300 mg double pain 600 mg they give 1 hour before the procedure. Generally, clindamycin is good only. We don't prescribe much very frequently, but it is also available and it is one doable tablet that you can think through if the patient is also presenting with a facial space infection, an abscess, okay, and a cellulitis. Probably clindamycin will be a better choice. Okay. So then we go to cephalosporins. So cephalosporins are most common of what do we give? Cephalexin, which is Sporidex or Fexin. So what is the dosage of Fexin? 500 mg. Same 500 mg. Okay, Fexin. It's given 6 hours. That is 4 times you have to give if it's going to be Sporidex because predominantly it has only a gram positive action. Gram negative is very, very feeble in case of first generation cephalosporin, which is a Sporidex. But if you're going to consider a pregnant woman who's allergic to amoxicillin, Fexin is a good choice of drug. Okay, because it's pretty safe. And allergy to amoxicillin irkumbodhu, better to avoid cephalexin groups also because both these share the beta-lactam component. So those who are allergic to penicillin might be even as well allergic to cephalosporin, but it is not a rule. You might get patients who are not allergic to even cephalexin. So this could be an alternative for your pregnant woman. Very mild dosage, okay, 4 times daily that you can give. Cefixim is your Taximo. Taximo the best indication in it. Oral Levit. IV, but indication, any gut related, GIT, exactly, any gut related, you have something related to your gut, no, Taximo works out really well. Or, of course, you have your metronidazole combination, ciprofloxacin and norfloxacin, usually, but Taximo works well, especially when you have something you are not very happy with your trinidazole group or metronidazole group. Taximo works out well because it's a 3rd generation cephalosporin, has an extended spectrum, both gram positive and gram negative. So you can consider this is 200 mg and this is twice daily, 12 hours. Okay, so it's twice daily that is good. Fluoroquinolones we have the ciprofloxacin. Next comment. Sometimes I have given, because I frequently give rather, if the patients are allergic to amox, I give ciprofloxacin group. It's 500 mg dosage every 12 hours. It is twice daily. Okay. It also has a very good spectrum. But one thing is that patient is on an anemic patient who's on any iron. Nowadays, most of the patients are on vitamin D supplements, calcium supplements. Be careful in giving that because it will interfere with the absorption. Okay. Left and right people are now taking shell cal, vitamin D. Most of us are vitamin D deficient only. If in the group life we check and see, 75% will be deficient. And 75% will be below normal or whatever. Nobody, I don't think so, will be at the normal level. Okay, so it's like that, and now vitamin D supplements are being given, D rice is being given. Levofloxacin is a wonderful drug. 500 mg once daily. It's given. In the levofloxacin, there was one time where we had all severe upper respiratory tract infection, severe throat pain and other things. That time levoflox once daily 500 mg worked really well. And the group of bacteria, it was just 2 months back. It was levoflox which was working out well actually. So your upper respiratory tract infections, also this is good. Only one thing is that levofloxacin you might get some resistance. So you have to be a little more careful because it has a wide spectrum. Once daily dosage. But again be careful when you are giving any antacids, calcium supplements, iron supplements, it will interfere with the absorption basically. Okay, so that's about your levofloxacin. And remember, we just don't treat only oral infections, right? Sometimes throat infection, cold. Many of the patients come to us also, and we have some students also coming us, ma'am, what to take for this? Then rather than going to ENT, they come to us. So be very well versed with, at that point of time, the strains are responsive to which group of drug. Okay, so that will really work out rather than at randomly giving any other antibiotic which is common. So then we have tetracycline. So this is also a wonderful group of drug. Tetracycline yeah. Yes. Okay. So if you think that there is a periodontitis, periodontal infection, any aggressive periodontitis, tetracycline is best. 250 milligrams 4 times daily. That's the dosage. An alternative to tetracycline will be doxycycline. Okay. Doxycycline. Ideally, the dosage is what?
1 per day. Initially 2 and then 1 per day.
Exactly. Initially, it is twice per day doxycycline, and then followed by this once per day. That's enough. Slow. Okay. So. Fine. So doxycycline is another group of drug, okay, related to tetracycline, but அது not like tetracycline 4 times கொடுக்க வேண்டிய அவசியம் இல்லை. So this we can give only once daily, twice daily you start off and then you can taper it off to once daily. So that's the essence of doxycycline. And remember, anything that you are going to do with periodontal therapy, something to do some UNAG, you are going to debride that area or SRP and you want an antibiotic, go for this group of drug rather than going for amoxicillin. Shift to this. Okay, that will work out well. Then we have macrolides. Levofloxacin. Doxy 1. Sorry? Tetracycline. Tetrabid there's one. Tetrabid, yeah. I didn't majorly put because I should not basically commercialize any particular brand, but still there are some photos which has macrolides.
No, group
Yeah, sure. Commoner ones, I'll just put it in the group name. So, this macrolides, as told, azithromycin. That's a wonderful drug. 500 milligrams, 1 time daily. 5 days, 3 to 5 days. Sometimes when you have this whooping cough, the dry cough and other things, works out absolutely well for your throat infections. Upper respiratory tract infections, azithromycin, replacement. But it also does well for our oral infections also. Only thing for azithro, remember, is it should be taken in empty stomach. At least 2 hours after your food or 1 hour before your meal. Okay, only then the absorption will be there. Azithromycin absorption will not be there. Okay, and erythromycin is also another wonderful drug because we had one patient who was allergic to all the antibiotics, including all analgesics also, except for paracetamol. She was allergic to all NSAIDs and antibiotics. The only antibiotic which she responded was erythromycin. Erythromycin, she didn't have allergy.
How did you find that she was allergic to all?
We gave an intradermal infection, an intradermal injection, because we already knew that she's an allergic patient. Allergy to amoxicillin was already proven. So then what we did was, since it was in the college, we gave an intradermal injection for all the other antibiotics one by one. Erythromycin she didn't give response. And then we came to know that erythromycin preferably is good for any patients who are allergic to multiple antibiotics. Because the allergy phenomenon with erythromycin is comparatively less when compared to other antibiotics. So intradermal is the best one. Illa, there are people who do with patch test also. When you have a known patient of multiple allergies or patient coming repeatedly with allergic stomatitis, patch test panni paakalam. Pannalum we can find out where exactly which is the allergen which is responsible for the allergy.
Just try to go to labs to do
Yeah. Yes. You have to refer that. Sorry? You can just write patch test, yeah. And then common allergens. You have 24 allergen kit, 48 allergen, and the one you can just mention and then you can send it off. If you have a drug history, it will be very good. You can mention what are the allergies that is already known for. It will be easy for them to evaluate also. And always have a connect between these labs, because when you talk with them, the rapport increases and the way what you want the report also will be better also. Okay, so that's also a good one. Remember, all these are all